Welcome to Return to Work Health and Wellness podcast. Today we are having a Q&A. I realize that employers are a bit wary of return to work and what that looks like. So I thought I'll gather some questions and answers and see if that helps employers to understand the legalities and the due diligence that they have to follow and mitigate risk through implementation of this return to work framework. So how to implement a back to work framework and why there's ROI? Why is there return of investment? What does that look like? First of all, what is a return to work framework? Well, a return to work framework is a structured, documented process that guides how your organization supports an injured or ill employee to safely reintegrate into work. It includes early intervention, functional ability assessments, modified duties, transitional work, and ongoing case management. And while following that structured framework, there is documentation, case notes, tasks, follow-ups, communication that is targeted to follow up and ensure the employee and yourself have a duty to participate. So there's more to this framework just to offer modified duties and bring the employee back. So why is a return to work now essential for South African employers? Well, under the COIDA reintegration direction, employers must demonstrate now that they actively support injured employees in returning to suitable work. There is no more of just having an employee leave and not able to return when they're incapable of doing pre-injury duties. They should be accommodated. So they should be upskilled. There should be opportunity for them to show transferable skills and what they're able to do. And once you have mitigated risk, you've done your due diligence, and it's impossible to bring this employee back, then only you have the evidence to show that you're unable to accommodate this employee. You have a duty to accommodate until undue hardship. And by proving undue hardship, you have to go through the framework. You have to follow a process. You have to have policies in place. So this means no more ad hoc decisions, no wait until fully recovered approaches, and no undocumented conversations. Return to work is now compliance requirement, not a nice to have. What are the key components of a compliant return to work framework? So a strong return to work program includes a formal return to work policy and governance structure, policies and procedures that is transparent to all employees. So clear documentation and case notes, who does what and when, and what have been done. All that needs to be documented. Functional ability-based decision making. When you work with your OT or with a physiotherapist, you have the functional abilities, you compare it to the physical demands of the job, and that's how you make your decisions. Or that's a starting point of making decisions with regards to modified duties. Also a structured accommodation process. Who's involved? Who's the decision maker? What questions do you have to ask? Who do you have to approach? Who needs to approve this? What is the pay raise or the lower in wages when there is a permanent accommodation? Modified duty and transitional work options needs to be within the framework, and collaboration with medical providers. When are you contacting your medical provider? Who are you contacting? What does the early intervention look like? What is the process? Can they send the updated medical? Can you ask for additional medical? When there's stagnation and there's no progression, what is your steps? How are you going to find out when this employee is going to show increase of function? How do you know if the employee is attending treatment? There's many factors with regards to return to work, and this is a consistent communication with the employee, crucial. So these elements align with the COIDA rehabilitation and reintegration regulations, which require employers to adopt new systems, policies, and measures to support reintegration. I hope I answered some questions. Again, if you have any specific questions that you need answers to, you're unsure what the next steps are, you're not sure what policies and procedures should look like, please reach out to me. I'm happy to assist and guide you through this process. Thank you.